to split the difference between the two. So you're always, always in perfect, relaxed, comfortable, seated archer stance. Okay. Then having opened that aspect, I get to the wrist. 45 degrees from the table. Keep the palmar aspect of the hand parallel to the coronal plane or table. Okay. Feeling on both sides of the joints. Okay. And I find about 2 o'clock, again, I feel the restriction. Rotate, find my correct vector, increase pressure until I feel the pseudo close. Okay, it could be anywhere from 3 to 30, in the beginning up to 45 seconds. When you get good at it, when the student becomes proficient, it's usually 30 seconds or less. I find that open. And then I'm going to do, again, the Kenbiki is a squeeze and a twist using my body weight to shift. So I never just use my hands like this. I put the base of my thumbs down, I lean, so I'm leaning into so that the base of my thumb closes with my fingers, and then I shift my elbows slightly, and that provides an effortless, deep, significant cross fiber in the hands. Okay. The reverse of that is to plant the base of my thumbs, hook my fingers, and use reverse archer stance to do the palmar side. Okay. Now I can do that from this position, or I can turn the hand over and cross fiber the palmar surface of the hand. Okay. Any subos I find, again, any mini zones I'm going to find the biggest subo in them, rotate the same as always. The base of the thumb is hugely important. The thumb is a saddle joint. It's the only joint so configured in the human body. Extremely important with our opposable thumbs. I'm going to use knife biki, which is the edge of number 2, and I'm going to lock and then weight shift in my reverse archer stance. So reverse archer stance is where I straighten the forward leg. Archer stance, I bend it to apply the pressure. Reverse archer stance, I straighten it to shift my body weight go in the opposite direction so that it all becomes an easy, effortless. I can do the deep work without getting any muscular fatigue, particularly in my forearms. Okay. Any subos I find, I do that again. I isolate, rotate, shift to make sure my position is comfortable, increase pressure. So that was doing the base of the thumb, then Kenbiki over the thumb surface itself. You want to be sure that you don't put a lot of excessive lateral force on their digit. I do that by laying my fingers underneath. Again, Kenbiki, I lean and shift across the finger so that I get a deep pressure without twisting her digit. When I come to the end, which is the sinus point, remember there's a whole body map on the hands. The end point is the sinus point. I lean. Okay. So I'm going to do that for each individual finger joint. So then I'm going to do exactly the same things on the anterior side of the arm that I did on the posterior. I'm going to cross fiber, going to find mini zones, treat the mini zone. On each major joint to major joint, the one aspect, major joint to major joint. The other aspects, exactly the same way I did on the lateral side of the arm. I'm going to come up, back up, and I'm going to do where the rib heads meet the sternum. Okay? On a female, of course, we have to skip the breast area. But the ribs are solid. They connect to the sternum, they come all the way around and connect to the spine. Any muscular tension on the ribs is going to cause imbalance at the rib heads, both the anterior and posterior rib heads. So I'm going to lay my fingers. If I come down directly in the center, first I'm going to explain to her I need to work the rib heads where they meet the sternum. It's very important on your back. It's not near anything personal. Do you mind if I come do this? So I put my fingers down in the center in a line, and I slide laterally until I find where the rib heads meet the sternum. Shift to make sure my fingers are in the space between the ribs, and look for any subos I find there. I find 2 on her. Then I rotate to get the best vector on the subos. Shift to make sure my position is good. Treat until the subos open. Then I'm going to trace the ribs around the chest. I'm going to rib sweep inferior and then superior. You want to stay in the rib spaces. Any subos I find. Again, as always, it's find the subo, rotate, find the best vector, raise my elbow slightly, bring my pressure, maintain until the subo open. I'm going to do this all the way down the ribs. Now we talk a lot about the 2 foundations. The neck is one end of the spine and one foundation. The other foundation is where the spine meets the sacrum and the coccyx. Okay, the sacrum is at the base of the spine, the inferior base of the spine. That's a bone about the size and shape of the palm of the person you're working on. It has 8 holes, 4 holes on the left and 4 holes on the right. Out of all 4 holes comes the famous sciatic nerve. It comes out in 4 branches. It trunks together, goes down past the ilium, which is the bone, the outer bones of the pelvic girdle. And then it truncates, which means comes apart to become the major nerves of the lower leg. So her iliums, I'm going to be able to use them to locate the pelvic girdle and how to best position my hand to reach the SI joints, the sacroiliac joints. I'm going to put the farthest away SI joint from me across the edge of my fingers, and the other SI joint across the base of my thumb. Then I'm going to just shift my weight to look for the subos that are along that SI joint. Okay? And the way I'm going to shift that is I move my elbow. I don't try to do it with my hand. I set my position, I move my elbow, and this allows me to find the biggest subo on each of the SI joints. So I take my hands and I come from the sides, and it doesn't matter how big the person is or if the woman is pregnant. Okay? No matter how, if we have twins and we have a large belly, we come from the sides, we're still going to be able to find the iliums. So we come in with what I call big, soft hands. Parallel, big, knife hand, and not tense, but just nice and soft and relaxed. Come from the side, then I lean, and I'll be able to determine the shape of her iliums. Okay? Now what I want is the most medial point on the right and left ilium. On a line directly between that most medial, on the opposite side is her sacrum. So by locating this bony landmark, I know exactly where her sacrum is on the posterior side. So having determined that, and the student can make a little mark in their clothing to help remind you exactly where it is. Okay? Or in the sheets, if they're covered in sheets on the table. Then I have a couple of techniques to get my superior hand, my hand closest to her head, underneath to cup the SI joints. I can use my archer stance seated, the greater trochanter of the femur, which is that bump right here on the side of her hip area, to move and slide. And I slide, and when I get, it just sort of fits. It's almost like 2 connectors fastening together. When you slide to the right point, it just fits. Now, say she was a very large person and a little more difficult to get the leg.